Hello, and welcome to Jacksonville Country Day Schools 2019-2020 Open Enrollment Period. Your open enrollment period is scheduled to kick off on February 20th and will go through March 1st, 2019. This year, ICUBA is excited to welcome 27 member institutions to our 17th annual open enrollment. We have some exciting information for you. Behind the scenes, ICUBA tackles the biggest challenges when it comes to your healthcare services. We want you to have the best access to care. We like to break down some barriers for you so you can get in the right place or the right provider at the right time. We want you to stay engaged to improve your health and well-being, and we provide several engagement tools for you through programs like Rally. We also focus on cost and quality. We want to provide the highest quality care for the lowest cost possible through our partnerships with several of our brand partners. This leads to better outcomes and hopefully improved health and well-being of our members.
Okay, so did you know that ICUBA medical plans are self-funded? And as a self-funded medical plan, ICUBA pays all claims processed by medical, pharmacy, and behavioral health from the premiums collected and reserves built up over the years. So ICUBA keeps all of your premium dollars saved for the exclusive benefit of you, our members. We spend premium dollars only on benefits for our members. And our plan is pretty unique. It's created specifically by educators for educators. And we invest in a long-term culture of well-being so you can be the best version of yourself. So how do we work to keep plan costs as low as possible? We do this by establishing some programs and efficiencies to help mitigate claims. All claims are, we break down barriers to care by adapting the plan to provide value and quality to you. And we do this through things like Blue Distinction Total Care Providers. So those co-payments are zero when you see a internist, a family practice doctor, or a pediatrician that has a Blue Distinction Total Care distinction on the Blue Cross and Blue Shield website. We also have $5 teledoc visits, a low prescription drug co-payment structure, and we encourage everyone to get their biometric screening so they know their numbers. We also provide case managers and care consultants, and we have innovative resources like ICUBA Cares, Teledoc, Rally, Resources for Living, and new as of April 1st of 2019, we're bringing on Surgery Plus. And so what can we all do as consumers to help the plan? Ways we can do that are outlined here in the presentation. You can make sure that you take advantage of your free preventative care screenings, register for Teledoc in preparation of an event such as a sore throat or a sinus infection. We have ICUBA Cares. If you call them, they can help you obtain lower cost prescriptions. You get 6 free EAP sessions. We encourage you to visit a dermatologist to get a free preventative cancer screening. You can use the Blue Cross and Blue Shield pricing tool to help you shop for the best price for advanced imaging. And then we also have the Rally City Challenges that you can sync with your device and for a chance to be entered to win a $50 Amazon gift incentive.
So we hosted a survey late last year, and we got some member feedback from you guys, and we realized that your main concern was the cost of the ICUBA benefits. So we did some digging in how we stack up against the others out there. So for what we realized during this process is that ICUBA's population is slightly older than the average population, and our plan covers less families. So we cover mostly that employee-only or employee-spouse tier, keeping those younger, seemingly healthier, on average, lives which have less risk associated with them. Florida is also one of the more expensive states to offer healthcare benefits, and our plan is also much richer in nature. So even with all of these factors coming into play, demographics, location, and plan value, we still show here that IQUBA is below the education industry as far as cost and pretty far below everybody else. On this slide, we show a little further on how we stack up against the others. So in the blue dot in the middle of these two bars, you'll see the average from all other PPO plans and the education industry. So what is shown here is IQUBA's pricing is 17% below the broad database benchmark average and 22% below the education industry benchmark. So even though our benefits might seem more expensive in nature, you're actually getting a really good bang for your buck. So what are we going to talk about during this presentation? We're going to cover enrollment and eligibility, some plan perks that IQUBA offers, and your 2019-2020 benefit plans.
Okay, so first up, under enrollment and eligibility, we have enrolling in your benefits. You'll do this at IQUBAbenefits.org. During open enrollment period, this is your chance to freely update your benefits for the 4/1/19 through 20 plan year. Your open enrollment elections do remain in effect until next plan year, and then you can make some changes mid-year only if you have a qualified life event, and of course you have to make that change within 30 days of that life event in order for it to be eligible. For your open enrollment, you'll log into the IQUBA benefits portal, and at the top of the screen, you'll see Start Your Enrollment, and you'll click on that button to begin your open enrollment elections. Also available is Ask Emma. Emma is available in English and Spanish. So if you have questions while you're going through your enrollment, you can just ask Emma. Emma is a decision support tool. She can help you make smart, cost-effective decisions to fit your individual and family needs. When you're first starting with Emma, she'll take you through a personalized walkthrough, so to speak. She'll ask you a few questions. And using these questions, Emma estimates your annual cost using real-life scenarios from your personal experience and premium contributions. There is also available some frequently asked questions on various benefit aspects of your benefits. So if you have questions about, say, maybe your deductible or one of the FSA plans, Emma does have those FAQs there for you. So if you're interested or if you're wondering what's the right plan for you, Emma is available in the top left-hand corner of your enrollment.
So who's eligible for the IQUBA plans? Your legally recognized spouse, a natural child, a legally adopted child, stepchild, a child required to be covered pursuant to a qualified medical child support order, a child that you have legal guardianship over who lives with you, and foster child. IQUBA's plan is unique in where we cover dependents until the end of the year in which they achieve or attain age 26. So if your dependent turns 26 in January, February, or March, they're still eligible for the plan effective April 1st, 2019. We'll just send you a reminder notice later in the year when it's time for them to come off. And they will be removed effective 12/31/2019. We know that everybody listening to this webinar reads all of the fine print before you submit your elections. But in case you missed this paragraph, it is part of that fine print before you hit the final submit button. You are just certifying that all the dependents on your plan or that you've enrolled are in fact yours.
Open enrollment sweepstakes. Again, this year we'll have a sweepstakes for those who confirm their personal phone number or personal email address is correct and up to date. There'll be an I agree box after you update that information, and then you'll go through the process and finalize your enrollment. Once you do that, you're automatically entered to win an Amazon gift incentive. We just want to highlight also the single sign-on feature available to you on IQUBAbenefits.org. With this single sign-on feature, you will be automatically logged into the various brand partner websites. If it's your first time accessing single sign-on, you may have to register and create a username and password, and then going forward, you'll be automatically logged in. With access to these sites, you can order order replacement cards, print out a temporary card for yourself. You can check your claim status, your benefits. You can find in-network providers. There's also some discounts available through some of the brain partners. So if there's a need or you just want to check them out and see what they're all about, you can go to the My Carrier Account section. They're located in the middle of the screen under the scrolling picture box on icubabenefits.org.
So with Jacksonville Country Day School's membership with ICUBA, you gain access to some medical plan perks with the medical plan. So the new benefit this year that will be accompanying the medical plan is Surgery Plus, and then we'll highlight some reminders on Teladoc, ICUBA Cares, and Blue Rewards powered by Rally. Brand new this year, we're excited to roll out Surgery Plus effective April 1st, 2019. Surgery Plus brings to us their Certified Surgeons of Excellence Network. With these, network participants are licensed, board certified, they've completed a fellowship, and they have proven lower complication rates. Through Surgery Plus, they will cover hundreds of medically necessary, non-emergent planned surgeries. There's a few listed here on the screen, and there's more detailed information contained and housed in the ICUBA Benefits portal. But they really cover hundreds of medically necessary non-emergent surgeries. So if you need a knee replacement, that is perfect surgery that you can know that's coming up that you can plan out. If you choose to take advantage of this benefit, we encourage you to call Surgery Plus Care Advocates, and they can help you handle everything from start to finish. You gain access to their full concierge team that can help you locate, schedule, coordinate your record transfers, and the full procedure. If you do decide to contact Surgery Plus for those non-emergent but medically necessary services, your co-insurance and deductible will be waived. This will eliminate the out-of-pocket cost related to the surgery itself. I will caution you that if you get a non-emergent surgery, such as a knee replacement, there are other costs that will flow through the medical plan, such as physical therapy and perhaps medications will still go through Optum. But with this benefit and Surgery Plus, the Surgery Plus team will locate the best fitting surgeon for your needs. They'll provide you with 3 of the top surgeons, their names, and a short bio for each of them. Once you decide with their concierge team on the best surgeon to fit your needs, they will book appointments for you and they'll manage all logistics. They'll also coordinate the full process for you and organize record transfers. You can call Surgery Plus starting on April 1st, and the first call length is approximately 4 minutes for them to establish you in their system. And from there, with them coordinating everything on the backside, the time to the procedure is approximately 35 days.
Next, we just want to review Teladoc. This is with a Teladoc benefit. It is bundled with your medical plan. It gives you 24 hours a day, 7 days a week, access to board certified doctors through the convenience of your phone or a video consult. It is an alternative to sometimes the costly urgent care and ER visits. So you can talk to a doctor at any time for a low $5 copay. If you've not already registered at Teladoc, we do encourage you to register now through the My Health Toolkit so that when you're sick, you don't have to bother with registration on top of everything else. We have a website and phone number that's available on the screen for you as well. And then if you're required to enter in a company code, that will be ICUBA. We just wanted to highlight some of the top diagnoses from Surgery Plus, and just to tell you, we do not intend for this to be a replacement for your primary care physician. It's just a convenient and affordable option for you to get quality care if you're away from home, maybe on vacation. If you need a short-term prescription refill, then the Surgery Plus team is there for you to access. There are not any controlled substances prescribed, so if you need maybe a controlled substance, you'd want to contact your primary care physician. Also available, we have the IQBA Cares Pharmacist Advocate Program. You can call and speak to a pharmacist directly and have your personal questions answered over the telephone. An IQBA Cares pharmacist can help you with medication management. They can help you with choosing between preferred and non-preferred medications. If you have a prior authorization, that step therapy or a quantity limit, they can help you navigate that whole process, coordinate with your doctor, and they can advocate on your behalf. They're available Monday through Friday from 9 to 5. Their number is here on the screen as well. We encourage you to call and just get a prescription checkup if needed, and just see what the program is about.
So moving on to Blue Rewards powered by Rally. The Rally incentive plan for 2019 and 2020 is relatively the same as last year. You still have the ability to earn up to $250 per covered employee and covered spouse. We've added a few coin incentives for you throughout the program. The Rally survey will still serve as the gatekeeper. So what that means is, first things first, you must complete the survey. And once you complete that survey through the process, you'll gain up to 400 coins. And then once that survey is completed, you'll have access to the other gift cards that are available for wellness exams and colonoscopies and the other items listed on the screen. We are still doing private sweepstakes for the survey, for the missions, and the challenges, which we will talk about a little bit more. And we've added some coin incentives for teledoc registration, tobacco attestation, and clinical rewards. Clinical rewards targets the chronic conditions shown on the screen here. So if you are identified through the claims process for one of these conditions, what this is going to do is it's just going to provide you a little bit more of education for these conditions. So your Rally homepage might look a tiny bit different, but if you meet the quarterly goals that they set forth for you, reading materials, and perhaps meeting with a health coach, you could earn 500 Rally coins per quarter, or up to 2,000 Rally coins for the year. So we encourage you to get engaged and get involved and know your condition to the best of your ability. The private sweepstakes will remain this year. Like I mentioned, the City Challenges was probably the most popular variation of our private sweepstakes last year because we gave away a $50 Amazon gift card every 14 days. So that will continue into the 2019-2020 plan year. So make sure that you are checking into these city challenges and syncing your device frequently.
Next, we just want to talk about the medical, RX, and behavioral health plans. We've strategically partnered with the best in class to offer you benefits. The medical with Blue Cross and Blue Shield, prescription with Optum RX, and Aetna for behavioral health and EAP. Get the care you need. Here we just wanted to highlight some of the services that you may need, you and your family members, and we've color-coded them with green for go, yellow you may want to proceed with caution, and then red are the services that you really want to be sure of. For the green, these are your first stop for everyday health issues, your checkups, preventative care. Those are the common illnesses and health screenings. If you're needing any of these services, we just recommend you consult your primary care physician. In the yellow section, we have teledoc, convenient care, which is like your Walgreens Minute Clinic, CVS Minute Clinic, or Walgreens Healthcare Clinic. And you would see someone like this if it's maybe after hours or you're not able to get an appointment with your primary, then you'd want to go to one of these locations, and they will usually deal with your sinus problems, ear infections, upper respiratory, nasal infections, allergies, sore throats. And then in red here, you have the emergency room. You'll go to the ER for your life-threatening health problems, chest pains, if you have major trauma or a severe burn, that's when you'll want to go to the emergency room to seek care. We also have health management and care consultants. These are trained healthcare advisors and registered nurses who can provide you with tools, education to help you manage your chronic health condition. They can help you with setting goals and assist you with better understanding your doctor's treatment plan. They can help you with referrals or transitioning or gaps in care. And so these individuals are calling you because they care. So we highly recommend that you take advantage of this valuable service. And if you receive a call, answer it so that they can help you manage your health condition.
Blue Cross Blue Shield has stepped up their game as it relates to customer service. This was some feedback that we got from that annual survey, and we shared that feedback with them, and they have installed some brand new technology and given us a dedicated, care-connected customer service team. So it's a brand new service with the same customer service phone number that is already on the back of your ID card, but with the new technology that they installed, with your ID number when you call in, if you call within normal business hours, you'll be routed, if possible, to the same advocate. This will prevent you from re-explaining your situation every time you call in. Hopefully the advocate will understand what you're talking about. You've been there, you've discussed this topic with them before, so hopefully it will help facilitate the process to quicker resolution. They've also been trained in IQVIA's benefits and should help you if you have particular questions about how the plan works. Just a reminder, all medically necessary services performed in a Blue Distinction Total Care, family practice, internal medicine, or pediatric office are always free. So if you're in the market for a new primary care provider, we encourage you to visit My Health Toolkit and filter on Blue Distinction Total Care and make sure that in their family practice, internal medicine, or pediatric profile, they do carry this designation. So all services performed in their office, if medically necessary, will be free to you.
Next, we want to go over the medical plans. Here on this slide, we have the preferred PPO plan. There are a few changes this year as relates to the deductible and out-of-pocket maximum for both the in-network and out-of-network deductible and out-of-pocket maximum. It's increased by $500. And then the family deductible and out-of-pocket maximum is increased by $1,000.
We're also offering the $4,000, $8,000 deductible PPO medical plan. This is freedom for families with children. If you have healthy families with children, this will provide premium cost savings to you and could be an option. We do want to identify some of the major differences in the plan offerings. We will caution you that the deductible and out-of-pocket on this plan are significantly higher than the preferred PPO plan. The coinsurance and copays are also higher, and while the premiums are less, a catastrophic event may end up costing you more. This is IQVIA's silver medical plan offering in the $4,000, $8,000 deductible plan. So at the very top, you'll see the deductible, coinsurance, and out-of-pocket that are those higher figures. And then in the light yellow, you'll see those higher copays and coinsurances outlined for just regular physicians, specialists, and therapies of those visits. And then in the bottom, in the gray, the Blue Distinction Total Care, Teledoc, Convenient Care, this is the same as the preferred PPO. So if you look at this slide, the medical plan comparison, these are the in-network benefits. So this will really highlight side by side where the differences in the preferred PPO plan and the $4,000, $8,000 deductible PPO plan, where the differences really lie.
Knowledge is power. So we just mentioned that the deductible and out-of-pocket is increasing. So we really wanted to just highlight all of the services that are available to you. And this is not a full list. These are just some of the services that do not apply to the deductible. So your annual checkups, if you're getting physical or outpatient therapy, ultrasounds, mammograms, your immunizations, all of the things listed here and many more are not subject to the deductible. So even though there may be some changes to the plan, they won't apply, to these portion of your benefits. And then on the other side of that, these are some of the things that are subject to the deductible. Only major services will apply to the deductible under the IQVIA plans. So if you have some hospital expenses, labor and delivery, an x-ray, an ultrasound, home health care, these major services are the only things under our plans that will be subject to the deductible. So that knowledge is power. Make sure you know what benefits are available to you.
The prescription drug plan is offered through Optum Rx and is paired with the medical plan. The tier structures are still here, so it's still preferred and non-preferred and divided between generic and brand name drugs. So you have the freedom to choose between retail and mail. What I will caution you to or highlight on this slide is that a 90-day supply will save you money. So you're free to get a 30-day supply at your local retail facility or pharmacy, and you can just pay the flat copay for the 30-day supply, or you can pay a 2-month supply and actually get 3 months of medication. So again, a 90-day supply will save you money. I just want to highlight some prescription drug freebies. If you have prescribed diabetic supplies or prescribed aspirin, prescribed with generic folic acid or generic prenatal vitamins, or those generic statins, if you're eligible for those, all of these could possibly be free under the prescription plan. You simply need to take your prescription to the pharmacy counter and see if you qualify. Optum Rx gave their website a little bit of a facelift this year. So if you've not been into the single sign-on at icubabenefits.org, we encourage you to go in and check it out. You can control things like your mail order. You can manage your medications. You can look at our prescription drug list, find pharmacies. There's a lot of cool things that you can do in Optum's new enhanced website.
Next, we'll go to the Behavioral Health and Substance Abuse Program through Aetna. You can get professional counseling, psychiatric medication evaluations. There are some benefits there as well for those on the with autism spectrum disorder, and they also have benefits for hospitalization, detoxification, and residential treatment through Aetna. We also have available to us a condition management program called ABLE2. With this program, you get 8 weeks, 2 sessions per week, 2 visits per week. All of your sessions are completely free, and so they will help and assist you with managing some life and health conditions that are listed here on the slide. You meet with your therapist and your coach once per week. And they can be by phone or video conferencing, and they're just really there to help assist you through some of the mental aspects that go along with your health conditions. I myself took advantage of this ABLE2 program, and I just had great results. I cannot say enough great things about this ABLE2. So if you or one of your covered family members have any of the health and life conditions listed here, I will highly recommend the ABLE2 program.
So with Aetna, they also provide not only our behavioral health and substance abuse, but they also provide our employee assistance program. So if you call the phone number, option 1 will direct you to the EAP, and option 2 will direct you to behavioral health. They've also provided us with some really good mobile applications, so you can download these to help get kind of overall coverage and assistance with your emotional well-being. Through the Employee Assistance Program, this program is not tied to the medical program, and you do not need to be benefits eligible to access the Employee Assistance Program. Simply for being employed by Jacksonville Country Day School, you gain access to this program. This is free for you and all members of your household and dependents up to the age of 26. You can gain access to emotional support, life support, legal and financial services, and this is 6 sessions per issue per year. So if you want to talk to somebody about raising kids, that's one issue, and tax season's coming up, you'd like some financial advice or some tax consulting on that side, you can call with questions about that too. Those are considered 2 separate issues, so you get 6 sessions, or up to 6 sessions rather, for each of those issues. And then if you are seeking out some counseling for the emotional or life aspects, I would encourage you to call the Employee Assistance Program first. Again, it's the same phone number, but if you access the 6 free sessions through a counselor, then it can be converted into the behavioral health benefit that's the co-insurance structure. Every call made to the Employee Assistance Program is free and confidential. So this is between you and whoever you're talking to over at Resources for Living. So we encourage you to take advantage of this really great benefit. The EAP received some feedback last year. Apparently, people don't like talking on the phone anymore. So they've partnered with a company called Talkspace, and you can now text or email your therapist. 1 week of Talkspace messaging is equal to 1 EAP session, and it's a platform that you can have unlimited multimedia messaging, including text, audio, pictures. There's an email feature through a web browser or the mobile app. This is not, I will caution you, this is not the instant gratification that you get from text messaging a friend back and forth. The therapist does have 1 working day to respond to you, but it is a great alternative if you just don't have the time to sit down and talk to somebody on the phone. I will also let you know that this benefit is available to users that are only 18 or older. So you must be 18 or older to use this benefit, and you must talk to someone at least 1 time because you must obtain authorization through Resources for Living. When you call Resources for Living, they will walk you through how to access the Talkspace benefit, and they'll walk you through downloading the app or setting it up on your web browser. These are your semi-monthly medical plan premiums, and I'm sure that these have been shared with you. And Jacksonville Country Day School is still contributing $500 annually to your HRA.
And that HRA benefit, it's a health reimbursement account. This account is funded by your employer, and you get a deposit at the beginning of the plan year, so that money will be in there as of April 1st. It is paired with your medical plan enrollment, so once you enroll in a medical plan, you're automatically enrolled in the HRA. There is vesting also in this plan, so once you're enrolled for 36 continuous months in an IQVIA medical plan, you are automatically vested in your HRA. So if you would leave Jacksonville Country Day for any reason, you would still be able to have access to the funds in that account via your IQVIA Benefits MasterCard or by submitting a claim. The funds in the HRA can only be used for eligible healthcare expenses incurred by you as the employee and your dependents that are covered under the medical plan. The HRA does roll over from plan year to plan year. So if you don't use all of that $500, anything remaining will be rolled over to the next plan year account. And this account also earns interest quarterly. You also have available to you a flexible spending account. First up, we'll talk about the healthcare flexible spending. This, unlike the HRA, is funded by you, the employee, with pre-tax contributions through payroll. The maximum limit for this next coming plan year, 1920 plan year, is $2,700. This is a use it or lose it plan, so just make sure that you're not putting in more than you need, because anything that you don't use, you'll lose at the end of the plan year. You can access the FSA through your IQVIA Benefits MasterCard as well. And so the funds in your HRA can be used for yourself and any of your taxable dependents. And we just want to note also that this does require an active election each year. So you do have to go in to the open enrollment through IQubaBenefits.org and elect the FSA each year. And then the last flex account is the dependent care flexible spending. This account is also funded by you, the employee. It's done on a pre-tax basis through payroll deductions. Unlike the FSA that's pre-funded and available to you up front, the DCA is available in line with your payroll contribution. So as you're paying through your payroll, the deposits are posted into the account. There is a calendar year limit of $5,000 per household. So if you have a spouse that's out there somewhere else, you just want to make sure that you check with your spouse to see if they've elected, if you plan on electing the maximum. Funds in a DCA can be used for child care for children under the age of 13 and adults who are physically or mentally unable to care for themselves by way of adult daycare. You can pay for, again, preschool, summer day camp, before and after school programs for your child, and then adult daycare for a spouse. Just keep in mind that this plan as well is use it or lose it, and it does require an active enrollment each plan year.
So the vision benefits are provided through IMED. Jacksonville Country Day School is offering two plans. So the main differences between the two plans, the base plan provides new frames every 24 months with a $100 allowance. And the buy-up plan provides frames every 12 months with a little bit richer $130 allowance. Here are your semi-monthly vision premiums. As you can see, they're not super expensive, so this benefit is a pretty good one. And if you elect this benefit but you don't need new glasses, I encourage you to at least take advantage of the vision screening and the discount on some cool new sunglasses. The dental plans provided, the first one is the high option PPO plan. This provides up to 4 preventive cleanings per year. It also has a $2,000 plan year maximum, and it has a $2,000 orthodontic lifetime maximum for each member. The DHMO is the second offering provided by Jacksonville Country Day School. This plan is only available in the state of Florida, so if you have dependents that live outside of the state, they will either need to come home for treatment, or I would suggest perhaps the high option PPO. If you are enrolled in the HMO plan and your Humana ID card does not have your dentist identified on it, I would encourage you to call Humana to make sure that you have that dentist, because with the DHMO plan, you must have a pre-selected dentist on file prior to seeking treatment. With this plan, there's no deductible or plan year maximum, and all of the services rendered are outlined in the dental schedule of benefits. This schedule can be downloaded in IQubaBenefits.org, and there are a few examples of the different co-pays for services that you will receive at the dentist. These are your semi-monthly dental premium plans, or I'm sorry, dental premiums.
And then we also wanted to just go over ACA. IQuba's preferred plan is equivalent to a gold plan out in the marketplace exchange. The $4,000, $8,000 deductible PPO is equivalent to a silver plan offered in the marketplace. We also have lower out-of-pocket costs, a broader network of providers, pre-tax benefits, employer contributions into the HRA, and more generous free wellness benefits are offered through IQuba. There's also a 1095 tax form that will be available in your employee file at IQubaBenefits.org. Again, this year, for 2018, these forms are not required to file your taxes, but you should keep them in your files for your records in case you're audited by the IRS. You'll have proof that you had insurance. And then we also just want to let you know that IQBA does meet all of the other requirements as required by healthcare reform. There are some mobile apps available to you, and we've put those up here on the slide. We did want to highlight the new Blue Cross and Blue Shield My Health Toolkit app that is available to you. So I just encourage everyone to at least download the app so that you'll have quick access to your benefits, providers, and then also your insurance ID cards are available on the apps as well. So these are some apps here. If you're interested in any of them, go ahead and download them. And if you have any spouses or dependents covered, have them download the apps as well. And then lastly, Rachel and I just want to thank you for your attention to our presentation. And in behalf of IQBA, we want to thank you for being members, and we wish you well in the 1920 plan year.